You know how some people, well, they just feel a little bit faint when they see blood,
Hmm.
but for others, it's way more intense. Sometimes they actually black out completely.
Yeah, it's a whole different level.
So let's dive into what's actually going on there. We're taking a deep dive into blood phobia today.
Right. Sometimes called hemophobia or hematophobia.
Or hemophobia, if you're using British spelling.
Exactly.
Yeah.
And what's really crucial to get right away is that this isn't just, a casual dislike. It's not being squeamish.
Yeah.
Blood phobia is an extreme, often irrational fear. Our sources really drive home how different it is from just a typical aversion. It can seriously impact a person's life.
Right, like those early experiences, maybe with blood or an injury, they can create these deep pathways in the brain, right? Associating it with danger.
Exactly. And that association sticks around long after the actual threat is gone.
So our mission today is really to unpack the mechanics of this specific fear. We want to explore, where it comes from, how it shows up differently, and what can actually be done about it.
Yeah.
And it's interesting how it's classified, too. It falls under something, the DSM-IV, called blood injection injury phobia, BII.
Right, the Diagnostic and Statistical Manual.
Mhm.
That category makes sense.
Yeah, and apparently similar fainting responses can pop up with related fears, like trypanophobia, fear of needles.
Yep, and traumatophobia, fear of injury itself.
So that immediately puts it in a recognized clinical context. It's not just some quirky thing.
Definitely not.
So what exactly is happening in the body then when someone faints like that?
Well, that fainting, the technical term is vasovagal syncope.
Okay.
It usually involves a really rapid heart rate at first, but then, boom, a sudden drop in both heart rate and blood pressure.
Oh.
Yeah, think of the vagus nerve. It's kind of like the body's brake system, controlling stuff in the chest and abdomen. In blood phobia, it seems like this brake gets slammed on way too hard when fear kicks in, and that causes the sudden drop, leading to fainting.
Wow. Okay. And how common is this whole BII thing?
It's actually more common than you might think.
Yeah.
Our sources suggest it affects around 4% of the population in the U.S.
4%. That's quite a few people.
It really is. A significant number of people dealing with this really intense reaction.
So knowing that many people have it, you naturally start wondering what causes it? Where does this intense fear actually take root?
Well, one factor that comes up a lot in the research is direct or even vicarious trauma in childhood.
Vicarious. So like seeing something happen to someone else.
Exactly. Imagine a really scary medical thing happening to you as a kid
Yeah.
or seeing someone else get badly injured. Those kinds of early experiences can really set the stage.
That makes sense. But is it only about experiences or is it maybe some kind of, predisposition, the whole nature versus nurture thing?
So that's a great question. There was a twin study we looked at,
Mhm.
and it suggested that things like social learning, picking up fears from others and those traumatic events seem more significant than genetics alone for blood phobia specifically.
Okay. But then sometimes phobias seem to run in families, don't they?
They do,
Yeah.
and that leads to a more nuanced picture. While that twin study points away from a specific blood phobia gene, maybe.
Maybe there's something broader.
Exactly.
Huh.
Other research going back to the early 90s actually suggests there might be a sort of common genetic factor, one that underlies lots of different phobias like agoraphobia, social phobia, and specific ones like blood phobia.
So like a general vulnerability.
Precisely. A shared genetic vulnerability that could make someone more likely, sort of predisposed to develop a phobia, and blood phobia could be the one that manifests.
So it's like having a general sensitivity to anxiety, maybe, and then your life experiences kind of direct it towards specific triggers, like blood.
That's a really good way to put it. It ties into this idea of elevated trait anxiety.
Trait anxiety, meaning.
Think of it as someone's baseline level of nervousness or anxiety. If someone naturally has higher trait anxiety, they're already in a more heightened state of arousal,
Okay.
which means their fight or flight response is just, well, easier to trigger. And maybe blood-related cues are what set it off for them.
Okay, right. So we've got these potential predispositions, the background anxiety level, and then the actual triggers. And you mentioned conditioning earlier. How does that fit in?
Conditioning is definitely a key piece of the puzzle. Painful experiences, especially ones involving blood or injury, can basically teach your brain to fear those things.
Like Pavlov's dogs, but with fear.
Sort of, yeah. A learned fear response. And our sources mention that about 60% of people who report having blood injury phobia actually link its start to experiences like that.
60%. That sounds pretty clear cut. But I think I remember reading something slightly different too, a bit of a counterpoint.
Yes, absolutely. And it's an important point about relying only on what people remember happened.
Memory can be tricky.
Very. So when researchers actually dug into detailed case histories, they started to question if those direct conditioning events were quite as common as people recalled.
Oh,
Yeah, they found some really interesting examples like a 13-year-old who fainted just after getting an injection.
okay, that seems fairly direct.
Maybe. But then there was a 6-year-old who fainted
Yeah.
just after a teacher gave a talk about the circulatory system.
Wow. Just talking about it, no actual blood or injury.
Exactly. No direct conditioning in the way we usually think of it. These examples really show that it's not always a simple case of bad thing happened, now I'm scared.
Yeah, the triggers can be much more subtle, almost symbolic sometimes.
That's a great way to put it. Symbolic. It seems for some people the fear pathway can be triggered in unexpected ways.
So for any one person experiencing this, it could be a mix of all these things. Predisposition, anxiety levels, maybe some conditioning, maybe some vicarious stuff.
Precisely. It's often a complex interplay. And the body's own mechanisms are central to it all. We mentioned the vagus nerve before.
Right, the brake system.
Yeah. That nerve plays a huge role in controlling heart rate, blood pressure, stuff in the chest and abdomen. And it's thought that during these blood phobia anxiety responses, the vagus nerve is really driving those physical reactions we see.
Which brings us to the symptoms, which sound pretty awful, frankly. It's not just feeling a bit jittery.
Not at all. There's a whole cascade of physical and emotional responses.
Okay, so physically, what happens?
Physically, you might get that initial spike in heart rate we talked about,
Mm-hmm.
followed by that sudden drop, the vasovagal syncope, potentially leading to fainting. But also, difficulty breathing, shaking, or trembling,
Right.
chest tightness, or even pain, feeling lightheaded or dizzy, sweating, getting hot or cold flashes, even nausea or vomiting for some people.
Man, that sounds incredibly distressing just on a physical level.
It is. And the emotional side is just as overwhelming.
What does that feel like for someone?
Well, people report just extreme feelings of anxiety or panic,
Hmm.
an overwhelming urge to just get away from any situation involving blood.
Like a powerful escape instinct.
Totally. And this feeling like they might actually die or pass out for sure. Plus, a real concern about losing control. It paints a picture of a truly debilitating fear.
Yeah, definitely sounds debilitating. So if someone listening recognizes these kinds of reactions in themselves, what are the options? I mean, how is blood phobia treated?
Well, the really encouraging news here is that blood phobia is treatable.
Okay, that's good.
Yeah, the standard approaches are often similar to other phobias. Things like cognitive behavioral therapy, CBT.
Right, helping change thought patterns.
Exactly. And desensitization, which is basically gradual exposure to the feared thing, blood, needles, whatever it is,
Yeah.
but in a safe, controlled way.
Slowly building tolerance.
hmm And sometimes medications might be used too, primarily to help manage the underlying anxiety.
Okay. And I remember reading about one technique that seems especially good for blood phobia because of the fainting thing.
Yes, that's applied tension. It's becoming increasingly favored specifically for this.
Applied tension, how does that work?
Well, remember how the fainting is often linked to that sudden drop in blood pressure?
Yeah.
Applied tension tackles that head on. It teaches people to deliberately tense major muscle groups in their body: arms, legs, torso.
Huh. Just tensing up.
Yeah, that tensing action actually helps to raise blood pressure.
Oh, wow. So it counteracts the drop.
Exactly. It can effectively prevent the fainting episode from happening.
That's fascinating. So you can literally use your muscles to short circuit the fainting response? That sounds really empowering.
It really is. And the fact that it's being used more and more with reports of good success is very promising. It really highlights that direct link between a physical action tensing and the body's physiological response to fear. It gives people a tangible tool.
That's brilliant. Okay, so let's just recap quickly. We've learned that blood phobia is way more than just being squeamish.
Definitely.
It can trigger this really unique physical fainting response, the vasovagal syncope. Its origins are complex, could be predisposition, could be life experiences, often a mix.
Right. Conditioning, trauma, anxiety levels.
But the good news is there are effective treatments. CBT, exposure.
And that applied tension technique, which seems particularly useful for the fainting part.
Yeah, really interesting stuff.
Absolutely.
So, thinking about everything we've discussed, this really powerful connection between the mind and the body in blood phobia. You know, how just a thought or seeing something can cause such a massive physical reaction.
That's quite profound.
Sort of makes you wonder, doesn't it? It leaves us with a question for you, the listener. What does this connection tell us about other surprising ways our thoughts and experiences, maybe even other fears we think of as irrational, might be manifesting physically in our lives?
Mhm. Thinking about that might open up a deeper understanding of maybe other anxieties, other physical responses, and what might be underlying them. Something to ponder.